Today we welcome Dr Ignacio Moncada, Chief of Urology and Andrology at Hospital La Zarzuela in Madrid, Spain, Director of Sanitas Institute of Robotic Surgery, Associate Professor of Urology at Francisco de Vitoria University, and Secretary General of the Spanish Association of Andrology and Sexual Medicine. Hello, Dr. Moncada. Can you tell us, please, what is Vitaros?
Vitaros is a new medication. It's a cream that it can be applied in the penis that it produces an erection. It's a new alternative for patients with erectile dysfunction.
Can we use Vitaros as first-line treatment for erectile dysfunction?
Yes, we can use Vitaros as a first-line treatment. In fact, the European Association of Urology has said that Vitaros is first-line treatment of erectile dysfunction. You can use Vitaros, or you can use a PDE5 inhibitor, or you can use shockwave therapy as a first line. So you have to discuss with the patient what is the best option for him. Sometimes patients prefer something that is applied locally instead of having a drug that can have systemic side effects like headache or some interactions with other drugs, and they prefer to use something that is acting locally in the penis.
Can you please elaborate on the efficacy of Vitaros?
Well, all the medications need to demonstrate its efficacy in clinical trials, and there have been phase 2, phase 3 open clinical trials with Vitaros that demonstrated efficacy of this drug. Of course, all the severities of the patients with mild, moderate, or severe erectile dysfunction have been tested in the clinical trials. All the comorbidities, patients with diabetes, hypertension, or radical prostatectomy have been tried in the clinical trials. And in all those segments of patients, the efficacy was high, particularly in some of them that there's an unmet need. There's patients not responding properly to the drugs that we have already. So there's a number of indications for erectile dysfunction because the efficacy has been clearly demonstrated in clinical trials that is high.
What about the safety profile of Vitaros?
When we use a drug, the two important things are the efficacy and the safety. Sometimes the drugs are very efficacious, but they have so many side effects that you don't use them. Some drugs are, very little side effects, but low efficacy, then you don't use that. The balance between the two is important, to have a good efficacy with low side effects. In this drug, the good thing is that efficacy is high and the side effects are low because they are only local. There is no systemic side effects. For example, if you take a drug for hair problems, you don't have any interaction with that because it's not absorbed. So there's many patients that take in nitrates or other drugs for the heart. They can take this very safely because there's not systemic absorption, there's no interaction between one drug and the other. And this, with the rest, some patients, they take in pills for the erection, they have severe headaches and other complaints that many times they say, okay, I cannot take this because of these so many side effects. With this drug, the side effects are very low. It's just, again, local, like sensation of slight burning in the penis that make the patient sometimes to think that the drug is acting, the drug is doing something in their penis. So I think in that sense, it's a very, very good drug to use in patients with erectile dysfunction.
Some men have a small urethra opening and the medicine that enters is not sufficient quantity. Can Vitaros be applied inside the opening of the urethra?
Yes, now the recommendation is to apply Vitaros inside the opening of the urethra, and it's quite easy to do. The syringe where the cream has a blunt tip, so it's very easy to use. So you can perfectly insert that inside the meatus, inside the opening of the urethra, and it makes the efficacy higher. If you just put the cream in the tip of the penis or in the glands, the efficacy is not so high, and it's no drug that can be wasted because drops off the floor or whatever. So the recommendation now is to apply this inside the opening of the urethra.
How many doses does a patient need to use in order to evaluate the efficacy of Vitaros?
Because it's used for a sexual encounter, sexual attempt, many times there's anxiety. When you are trying a new thing, a new drug, you're always thinking, oh, this is not going to work on me, or this is going to have adverse events. You tend to observe yourself too much, and it produces anxiety. So it's not only one dose that it can show you the efficacy. Can you evaluate the efficacy of the drug? You need to try a few times. There is some consensus that there should be at least 6 to 8 times to try to evaluate the final efficacy. If you, after 6 to 8 times, you say, okay, this is good for me or this is not working for me, maybe you can have a better opinion than if you try just once and then you make your opinion. This is not enough. There is some questions that some patients sometimes ask the doctors about, for example, the number of times they can use this, or they can use any drug. That this is very variable, depends on the sexual habits of the patient and the partner. So sometimes they like to have sex, let's say, every day. Not the majority. The majority of patients will have sex like 1 or 2 twice per week, depends on the age. But the Vitaros can be used as many times as the patient wants to. Typically, a couple of times a week. This is the let's say the regular use. But there are some patients that use every day and they're happy with that. Some patients use this every 15 days. That's fine. Depends on the habits and depends on the profile of the couple, of the patient, and all that.